Hi, this is Dr. Rafael Urbino here at Westside Dental Center in Plantation. I'm a graduate of the University of Florida College of Dentistry, and I've been practicing dentistry in the South Florida area since 2005. Today I'm going to explain something called a coronectomy procedure. And this procedure is something that we do quite often on patients who did not have their wisdom teeth extracted when they were supposed to. Typically between the ages of about 15 and 18, those wisdom teeth are only about 1/2 to 2/3 developed on that root. But as we get older, that wisdom tooth continues to grow, and it can become a problem later on in life. And the reason is this tooth, as it develops, the roots get longer and longer. And as they get longer, they get closer to a nerve in our jaw, which provides sensation to our lip and other structures in the oral cavity or the mouth. And those roots run right or can be in very close proximity to that nerve. When you try to get that entire tooth out, you can sometimes create some nerve damage here. In some cases, that tooth doesn't come right out. And in those cases where we don't want to go digging down here for roots right along that nerve channel, we cut the crown of the tooth right around about halfway down those roots, and we get this top part out. Because this top part here, a lot of times later on in life when patients start having problems with bacteria and food getting caught around the gums of the tooth, can create an inflammation. Same thing over here on this wisdom tooth in this area here. And as long as there's no infection along the bottom of these roots down here, then we can successfully and predictably cut that crown off and about half of those roots and leave those roots buried down there without any little or no risk of causing nerve damage here, which can be transient, last a couple weeks to a month. Sometimes it can last a little bit longer, sometimes a year, and in very few cases that nerve damage can be permanent. Coronectomy procedures leave little or no risk of nerve damage. Some of the benefits are also the recovery time is better because the bone heals around those remaining roots that we left buried in the bone, and in almost all cases you'll never even know they're there. In cases where we didn't get these teeth extracted at the ideal development phase and we're having a problem with a wisdom tooth later on in life and it doesn't easily come out, or it's in very close proximity to that nerve, then a coronectomy procedure is a very successful procedure. Thank you very much.